Hello, and welcome to this video for successful bowel and bladder preparation for before and during radiotherapy treatment to the prostate and pelvis. You've been asked to watch this video as you are due to receive radiotherapy to part of your treatment plan that requires preparation to ensure successful treatment implication. Radiotherapy treatment is high-energy X-rays delivered into a specific part of your body to target cancer cells. Radiotherapy will hit normal cells in the treatment area as well as the bad cells. Good cells can recover over a period of time, and bad cells cannot. This is why you may receive your treatment over a number of days or weeks. You can get side effects with radiotherapy, which your doctor or radiographer will discuss with you during the consent process and throughout your treatment. Do not hesitate to ask your healthcare professionals any questions as you go along the pathway. Radiotherapy treatment will take around 15 minutes in total each day. It is pain-free, you will not feel anything, and you will be required to lie still and breathe normally during this time. Your team will support you and talk you through the process each day. You are safe to be around children, pregnant people, and pets during radiotherapy. You will not be radioactive. Before you have radiotherapy, you will be required to have a CT planning scan. This helps us to map out exactly where the radiotherapy needs to be delivered. To help with the radiotherapy setup, you may be given 3 permanent tattoo marks during this scan. You will require to be exactly in the position for radiotherapy and will be required to carry out some bladder and bowel preparation before this scan and daily for your radiotherapy. The rectum, bowel and bladder sit very near the prostate or prostate bed. These normal organs do not need to receive large amounts of radiation, or else you may get more significant side effects, such as diarrhea or urine changes. This is why we ask you to complete the preparation. This also ensures that we effectively treat the required target area. If this is not carried out successfully, this can delay your treatment or cause unwanted side effects, and we may have to send you away from the department or make treatment adjustments if the preparation is not carried out successfully. You will be provided with a prescription to collect rectal suppositories. You will need to insert one into the rectum 2 days before your CT planning scan and 2 hours before your CT planning scan. Then, the same daily before each radiotherapy treatment will ensure there's no excess faeces or gas in the rectum that can push towards the prostate area. For example, if your scan is on a Wednesday, you should insert Monday morning, Tuesday morning, and ideally around 2 hours before your scan on the Wednesday. You should remove the plastic packaging from the suppositories provided and insert with a finger into the back passage. People usually find it useful to lubricate the suppository with water first. Push the suppository as far as you can into the rectum. Then squeeze your bottom tight and hold onto the suppository in the back passage for around 5 to 10 minutes to allow it to work effectively. You will get an overwhelming feeling to open your bowels. This is normal. The suppository should only cause one good bowel motion and not have an impact on day-to-day activities. If you have an allergy or concerns using the provided suppositories, please let us know. Before your scan and during radiotherapy, we ask you eat your normal diet and eat regularly, but we advise you avoid food or drink products that you know may make you feel gassy. These may include spices, baked beans, lentil or lots of green vegetables. Also, alcohol and fizzy drinks should be avoided. It is also very important to stay well hydrated before and during the period of your radiotherapy treatment. We ask you drink 1.5 to 2 litres of fluid daily. Try to consume your fluids through the daytime and not late into the night, as you may be woken several times in the night to pass urine. These fluids should mainly consist of water or diluted squash to ensure they do not irritate your bladder. Please avoid caffeine, fizzy drinks and alcohol as they irritate your bladder and make you need the toilet more often. You can purchase decaffeinated tea and coffee products, but these should not subsidise your water intake. Comfortable clothing is advisable. Slip-on shoes or slippers to aid removal. Patients often prefer trousers or joggers that are easy to slip down without belts and remove any loose change from your pockets. Radiotherapy is a localised treatment only affecting the area that requires treatment. We expect each person to experience some side effects from radiotherapy, and these should have been discussed during your consent process. Radiotherapy side effects usually start halfway through radiotherapy and peak around 14 days after completion. Side effects can take up to 6 months to recover, and some patients have long-term changes. We will discuss these again with you periodically throughout your treatment pathway. You should be reviewed regularly on radiotherapy to help you manage the common side effects. Fatigue, the feeling of tiredness, lack of energy is very common with radiotherapy. Increasing urine urgency, frequency, reduced flow and nighttime visits. Bowel changes such as loose motions, passing mucus and blood, and changes in your regular habit. Please speak to a healthcare professional, such as your key worker, if you have any concerns. Thank you for taking the time to listen to this video. If you have concerns or questions, these can be addressed when you attend for your scan or for your treatment. However, if you have a question that cannot wait, please contact Singleton Hospital and ask for the radiotherapy department via the switchboard, or you can contact your named key worker or specialist nurse. For further support through your diagnosis, we also have a local Maggie support centre located in Singleton Hospital, who can provide regular support groups, financial benefit advice, and you can drop in for support for you and your family.